Hello, good afternoon. Thank you very much for the introduction. As you already know, my name is Dr. Tosin Majekodunmi. I'm a cardiologist, and you might find it a bit strange to wonder why a cardiologist is coming to a wellness event. But I think it's actually very appropriate that someone like myself, who deals with people after they are sick, is here to discuss some of the reasons why people become sick in the first place and things we can do to avoid becoming sick in the first place, because the old adage, prevention is better than cure, continues to be appropriate even to this very day. So why is a cardiologist talking to you today about wellness and the importance of cardiovascular disease in terms of health? Well, simply put, cardiovascular diseases are the #1 cause of death globally. Now, previously it was thought that in Nigeria and other West African countries, or third world countries as we used to call them, that cardiovascular diseases were not important, and it was things like malaria, typhoid, cholera, etc., what we call infectious diseases or communicable diseases that were more prevalent in our society and were the biggest health concern for us. But as years have gone by, certainly from when I was a child to now that I'm an adult, the equation has changed. We no longer, malaria, typhoid, cholera, thankfully, are no longer the major health problems that we face today. Now that we have adopted Western lifestyles, we've adopted Western diets, we are also beginning to develop Western diseases, which include cardiovascular disease, obesity, hypertension, diabetes, high cholesterol, and all of these things will contribute to cardiovascular diseases being a major cause of death. And now cardiovascular diseases, even in Nigeria, are becoming a major cause of death. As you can see here, an estimated 18 million people died from cardiovascular disease in 2016, representing about 31% of all deaths worldwide. And of these deaths, 85% are due to heart attack and stroke. I just want to ask, by a show of hands, how many people know someone who has had a stroke? Show of hands. Okay. Almost at least half or 3/4 of the audience know someone who has had a stroke. And I always tell my patients, I'm a cardiologist, but I don't talk to my patients or scare my patients with heart disease. I scare them with stroke. Because most people who have seen someone who has a stroke will never want that for anybody else. And that is the best way to scare people into taking their medication. Of the 17 million premature deaths, a high proportion of them are into low and middle income countries like Nigeria. Most of these cardiovascular diseases can be prevented through a lot of the wellness strategies that I'm going to be talking to you about. And people with cardiovascular disease need to be monitored, they need to be followed up, they need to be under constant surveillance by an appropriate healthcare professional to guide them into reducing their risk as far as possible. So I don't know if this slide is projecting very well, but I thought I would try and get some statistics on Nigeria specifically. And as you can imagine, it is not easy to get statistics in Nigeria. However, there are some trends that are very clear. There are some statistics that state that about 1 in 2 Nigerian adults has high blood pressure. About 1 in 2. That's a startling statistic, and it's actually true. I see so many people from the ages of 30 to 80, almost all of them have high blood pressure. It's so common, it's almost normal. And by this WHO statistics, we see that about 11% of deaths in Nigeria are said to be attributable to cardiovascular disease. My suspicion is that it's a lot higher than that, and that these numbers are very conservative, because this is what gets put into the WHO database, and I suspect that is not the full data sets that we should be looking at. And if we look at the goals that the WHO have set for us, they look at tobacco smoking on the left-hand panel, which is high. When I was young, hardly anybody smoked. But now it is very common to go around night spots, hotels, clubs, and you see a lot of young people smoking, both men and women, which was very unusual. And this is storing up for us a store of people who are going to have cardiovascular disease and likely to have cardiovascular mortality coming up in the future. Obesity is growing in our society. When I was younger, we didn't see so many people who are overweight. Now it's becoming increasingly common. And as I've talked about high blood pressure before, this is very, very common. It's almost at epidemic levels in our society. So I need to talk about the risk factors for cardiovascular disease. This is what you're all interested in. It's okay to talk about cardiovascular disease as an abstract concept, but this is the thing that brings it close to home, that makes all of us sit up and pay attention. What are the things that all of us have that puts us at risk of having cardiovascular disease, this #1 cause of death worldwide? And there are a number of factors that have been very clearly identified. The first is age. As we get older, we are more at risk for cardiovascular disease and cardiovascular complications. Now, I don't think there's anybody who does not want to get older. Whether we like it or not, we are all getting older and there's nothing we can do about it. So there's nothing we can do about age as a risk factor. Family history is another risk factor. None of us can choose our families. We are where we are born to who we are born to. But what is important is that we know what our family history is and we pay attention to it. So we understand that if you're a 45-year-old man and your 48-year-old brother has a heart attack, and your father probably died suddenly when he was 50-something, then you should understand that you are also at higher risk for having a heart attack as well. I need to pay more attention to your risk factors than anybody else. So knowing your family history is very important. It's very common when I speak to my patients and they tell me, oh, I had a brother who died when he was 43. And I said, what did he die? They said, he was sick. We need to move away from that and try to get a bit more specific about what exactly did they die of. Sometimes it can be difficult to get this information from medical practitioners, but we need to make the effort because knowledge is power. Knowing that information can help prevent another unfortunate outcome. And then other risk factors are diabetes, which is increasing in incidence in our society, hypertension we've talked about, high cholesterol. I mean, when I was growing up, again, we didn't used to have so much in terms of fast food available. Now everywhere we go, there's fried food everywhere in terms of fast food outlets, which a lot of people enjoy. A lot of oily foods in these outlets as well, which is increasing the amount of obesity, the number of people who have high cholesterol in our society. Smoking I've talked about, and obesity I mentioned. So, talking about diabetes, this is from the American Heart Association, and about 68% of people age 65 or older who have diabetes die of some form of heart disease, and about 16% die of stroke. So diabetes is a very strong risk factor for having cardiovascular disease and having cardiovascular death. So if there's anybody here who has diabetes, or you know anyone, your parents, sibling, whoever, who may also have diabetes, it is very important that they pay very close attention to managing their diabetes properly because they can reduce their risk by doing so. Adults with diabetes are 2 to 4 times more likely to die from heart disease than people without diabetes. Just think about that. 2 to 4 times more likely. Even if you do everything right, you are still 2 to 4 times more likely to die of heart disease if you have diabetes. And diabetes, for most of the people that will have it, is something that is acquired. So it comes through your lifestyle. Either being sedentary or eating the wrong foods, not exercising, being overweight. So by trying to control those things, you can actually prevent yourself from getting diabetes and putting yourself into this category of people who are 2 to 4 times more likely to die from a heart condition. And the American Heart Association considers diabetes to be one of the 7 major controllable risk factors for cardiovascular disease, as we've talked about. So just giving it pictorial perspective, as I mentioned, 2 to 3 times increased risk of heart disease. 30% of coronary stents implanted in 2011. So I'm an interventional cardiologist, and implanting stents is part of what I do for a living. Interestingly, this week I've had 2 people. One was diabetic, who needed a stent because she was having a heart attack, and I had another gentleman who was not diabetic, all he had was hypertension. and he also had a heart attack with 2 major blood vessels blocked that he needed stented. And he was just hypertensive. He never smoked, cholesterol is normal, he's only about 63, not diabetic, and doesn't have a family history, just hypertension. And he had a heart attack with 2 major blood vessels blocked. Okay? So these risks are real and they exist in our society. We need to be more educated about being aware of them and knowing what we need to do to stop them. 280,000 heart attacks in the US, 2 to 4 times increased risk of heart disease, 60% risk of dying from heart disease. So all of these things are potentially preventable just by lifestyle modification, not even tablets, just lifestyle, exercise, eating well, keeping your weight down, all the things that we have been talking about. These are the things we all need to do to reduce these risks. And this is just another slide showing the same thing. So you can see from this very old slide from 1991 that people who have diabetes, for men, you can see that their mortality rate when they have diabetes in red is much higher than for men of the same age with no diabetes. And for women, the same applies. So just reinforcing the point that if you have diabetes, your risk is so much higher of having a cardiovascular complication or dying. So the best thing to do in this situation is don't have diabetes in the first place. This is a great slide. It's just looking at high cholesterol. This is looking at the risk of people dying or having a cardiovascular complication if they have a high cholesterol. And everything you see to your left of that vertical line shows that you are increased risk of a cardiovascular complication or of mortality. And as you can see, if you look at all manner of classes of people, whether they have diabetes or not, whether they have vascular disease or not, all of them have an increased risk of complications if their cholesterol is high. And this is showing that if someone has a high cholesterol, and in spite of taking simple measures, their cholesterol doesn't come down, if you don't treat them, okay, their survival is very low. You can see the red line, it comes from 100 to at 12 and a half years, about 60% of those people have died at 12 years, just because their cholesterol is high and they weren't taking any treatment. For those whose cholesterol is high and they take their treatment and they don't stop taking their treatment, they're on the blue line. Their survival is 80% as opposed to under 40%. So again, if you are in the situation where you've tried all the things you can try, your cholesterol is high, and it's not coming down by you managing your diet appropriately, which does happen, then when you are prescribed the tablet by your doctor, please take it. Something else I tell my patients, whether they're hypertensive or they have high cholesterol or they have diabetes, is that once we have made the diagnosis that you have one of those 3 conditions, it is forever. It is not something that you have for a while and then you stop and then it's okay. It is forever. So if you are diagnosed at 40 of having high blood pressure, when you are 100, you are likely to still have high blood pressure. It is not a curse. It's not a prophecy. It's very important that we give that message as medical practitioners, because one of the disasters that we see is people who we diagnose with high blood pressure, they take their tablet for maybe a year and their blood pressure is okay because they're on their tablet, so for 2 years, and then they stop. Because they think, well, my blood pressure has been okay, do I have to be taking this tablet all the time? And they stop. And then they have a heart attack or a stroke. It's a disaster. And it's very painful, because all we say is that, so the only thing this was costing you to stop you from having a heart attack or a stroke was just to take your tablets, as opposed to being admitted to an ICU or having a heart attack that needs stents and all the money that incurs as well. That does not compare to the cost of buying your prescription every 3 months and seeing your doctor once every 3 to 6 months. So I would implore anyone here or anybody who has a friend, a relative, a sibling who has these conditions and you know that they are careless with taking their tablets or not going to see their doctor regularly, please go and speak to them, send them a message. They must take their tablets, and it is forever until a cure is invented. There are a small subset of people who may be cured from these conditions. So I'll talk about that when I come to talk about obesity. I go and check my blood pressure constantly. If it's high normal, I know I'm having a problem and I need to do something about it. So everyone, there's nobody in this room who should not be having their blood pressure checked a minimum of twice a year, just to be sure whether you have hypertension or not, because I think I heard a speaker speaking earlier say it's a silent killer, and that is the real problem with hypertension. You don't feel anything. You were going about your daily business. I was working with I think it was SynLab, and we did an outreach somewhere. I can't remember, Dr. Ojo, I can't remember where we did it. And we had a lot of people come in to see us just to have their blood pressure checked. I had a woman come in, her blood pressure was 240 over 140, and she's walking around like nothing was going on. She didn't have a headache, she didn't have chest pain, she had nothing, and that was her blood pressure. And there are hundreds of thousands of people like that in Lagos today just walking around. I call them ticking time bombs. So everybody should know what their blood pressure is and be checking it consistently, because your risk is very high. Again, this is a very similar one to the one I showed you earlier, looking at the risk of people having a problem with varying degrees of blood pressure. So if you look at it, those in the light blue line have the lowest risk because their blood pressure is between 110 to 119. And as you gradually go up each blood pressure reading, your risk keeps on increasing. And if it's over 160, look at how high the risk is. I also wanted to talk about smoking. Smoking is a risk factor, as I mentioned earlier. It's a very strong risk factor. In fact, I have a rule about smoking when I see patients who smoke. The youngest person that I've had to take to the cath lab who was having a heart attack and needed a cardiac stent was a 30-year-old gentleman. He's Nigerian, doesn't smoke heavily, used to smoke socially. Just I spoke with my friends. He had a heart attack, had to go to the cath lab and get a stent. He almost died actually, but he was lucky he survived. Whenever anybody who smokes tell me that they have chest pain, for me it's a heart attack until proven otherwise. Every time. You come and see me, you tell me you have chest pain, one of the first questions I will ask you is, do you smoke? If you say you smoke, my alarm bells are firing off for not saying this. The other questions, of course, I will ask you if you're hypertensive, if you're diabetic, if you have high cholesterol, if you have a family history. But the biggest one for me is if you smoke. So for anybody in the room who smokes, please, today is the day you stop. There is no reason, there is nothing good that comes from smoking. I understand enjoying fried chicken. I understand chocolate and cheesecake. We all get that one. I understand enjoying wine a little bit too much. That's all very understandable. I do not understand smoking. So please, anybody who smokes or you know someone who smokes, please implore them. They need to try and stop. Can you help me move the slides forward, please? So, and this is the problem that smoking causes predominantly. It blocks blood vessels, and that's what causes a heart attack. So this is the reason why smoking is so bad. To a slightly lesser extent, the same occurs with hypertension, with diabetes, with high cholesterol. This is the big problem. It blocks the arterial blood vessels, the organ where the blood vessel is, which is blocked, gets damaged, whether it's the heart, whether it's your feet. One of the biggest causes of amputation in Nigeria today is diabetes and poorly controlled diabetes. I saw a lady who was in her 40s who's had an amputation already and is in a wheelchair because her diabetes wasn't very well managed. She got an ulcer on her foot. It didn't heal, and the only way to deal with it was to amputate the foot. So again, these are reasons why we need to pay attention to all these things, because they are largely preventable. Next slide, please. And this is showing again for smokers, if you look at the risk for men who currently smoke, up at 15% compared to less than 8% for men who never smoke. If you look at for women, the same applies, although to a lesser extent. Next slide, please. overweight and diabetes and obesity. I said I would talk about this. So if you look at the risk of cardiovascular disease, you can see here for both men and women, if you're of normal weight, the risk is fairly low at 1, but as you become overweight, the risk starts to go up to about 1.6 times, and as you get into the morbidly obese range with your BMI over 40, it shoots way up. So it's very important, as I mentioned, for all the reasons we talked about before. Obesity is becoming increasingly an epidemic in our community. Losing weight is a very, very big deal. Losing weight is not, for me, is not about looking good. Losing weight is about preventing people from having the higher cardiovascular risk you see on the right-hand side of this screen. In fact, it's such a big deal that the European Society of Hypertension and a few other societies, and the American societies as well, have now incorporated weight loss surgery into their guidelines for helping people lose weight, because before it was seen as a luxury that people who are very overweight just wanted to look good, and it was a bit of a cosmetic thing, so everybody kind of frowned upon it. But now everyone recognizes that weight loss surgery is actually is part of everything else we need to do to help people lose weight, because once people are into this morbidly obese range, the problem then becomes they can't do the things that we want them to do. So exercise becomes very difficult. So because of the weight, they now have diabetes, they have high blood pressure, they have sleep apnea, they have high cholesterol. What the weight loss surgery can help them do, and we do this at Euracare, is to help to bring their weights down, but they still need to do all the lifestyle changes to help them to keep the weight off once the weight has come off. And I mentioned about the cure for hypertension, for diabetes, for high cholesterol. This is one of those cases where hypertension may not necessarily be permanent. So if you are very obese and you have high blood pressure, you have diabetes, you have high cholesterol, you have sleep apnea, if you lose weight, the blood pressure can go away, the diabetes can go away, the cholesterol can go away, the sleep apnea can go away, all just from losing weight. Now, whether you're able to lose the weight naturally, in quotes, by just exercising or dieting, or you decide to do weight loss surgery, nobody cares. All we care is that the weight goes. If it goes, all of these things can go. I know people who are diabetic, who are on insulin, and then the moment they had their weight loss surgery, lost 30, 40, 50 kilos in weight, they didn't need their insulin anymore because their diabetes went, they didn't need their blood pressure tablets anymore because their hypertension disappeared. So this is one of those few cases where high blood pressure may not be permanent if it's weight related and you're able to lose weight. Next slide. Okay, so this is just again showing increased risk of heart disease with smoking. And as you can see, if you smoke a little bit, the risk goes up. If you smoke a lot, your risk is very high. Next slide, please. So I've talked about all the bad things. I've talked about the cholesterol, the diabetes, the weight. We've talked about those things. So the question now becomes, what can we do about it? What can we do to effectively reduce our risk of all these things, or to treat them if we already have them? We call it as simple as A, B, C, D, E. So we assess your risk. What is your risk? Okay? There are lots of things available. If your risk is more than 10% a year of having a heart attack or a stroke, there is some people think there may be a benefit to starting you on a small dose of aspirin. If you have blood pressure, if you have high blood pressure and that's been proven, you need to treat it to, previously we used to say less than 140 over 90. Now, we've been told it has to be 130 over 80, which made all of us cardiologists break out in a cold sweat. Because previously, almost half of our patients, whenever we didn't get them to 140 over 90. Can you imagine how many more now we don't even get to 130 over 80? And if anybody has high blood pressure and you're on one tablet, please run back to your doctor. It is very unlikely to be controlling your blood pressure. I start my patients on a minimum of 2 tablets straight away, without discussion. I never start anybody on 1, because 1 is very, very unlikely to control your blood pressure. Cholesterol, with their lifestyle interventions, by exercising, changing your diet. We all know what to do. Stop eating fried food, stop using so much oil, not sugary drinks, low salt. All these things are things that we all can do to reduce the amount of cholesterol in our diet. eating a lot of salads and things like that without adding too much salad cream and putting so many things on it. They are not very nice to eat. There is no running away from that. It's not as nice as eating all the other things. And I'm a human being as well. I try not to be too strict with my patients. So I say you can cheat. You can cheat once a week. Eat something you like, something that's a bit naughty once a week. It's okay. It makes you at least enjoy life. Otherwise, life is going to be very miserable if all you ever ate was salad all day, every day. But at the same time, you must take steps to control what you eat and keep it under control. Smoking, on that I have no discussion, no leeway for maneuver. Smoking is universally bad and should just not happen. Even one cigarette a week is one cigarette too many. Cigarettes is just zero. Diet and weight management I've talked about, diabetes prevention and treatment, and then regular physical activity, physical exercise. Next slide, please. So what lifestyle changes should we be doing? If you don't smoke, you can reduce your risk by 76%. If your BMI is less than, if you smoke, your risk is up to 76%. If your body mass index is more than 25, it's more than 40%. If you eat 5 portions of fruit and vegetable per day, 23%. If you take exercise of more than 150 minutes a week, 22%. If you manage to do all 4 of those things, your risk for having any problems with cardiovascular disease is only 3%. So just by doing those 3 things, and you notice that none of those things has anything to do with seeing a doctor. None of those things has anything to do with taking a tablet or having an operation. Just by not smoking, keeping your weight BMI under 25, eating 5 portions of fruit and vegetable a day, and exercising for almost 3 hours a week, you reduce your risk of a cardiovascular event to only 3%. That is something well worth doing, and something that is well within the capability of everybody in this room. And the good thing about this as well is it's very cheap compared to going to see a doctor or having an operation or taking expensive tablets potentially. So these are easy things that everybody can do, okay? If you look at this study, it looks at diet. Now this diet, some of these are very difficult. If you just take a normal diet, your risk is relatively high, but they've shown that if you just take a Mediterranean diet, which includes extra virgin olive oil and nuts, which I'm not sure is entirely culturally appropriate for us who like our swallow and etc., you can reduce your risk. Again, this doesn't involve any tablets or seeing a doctor, it just involves taking a diet. Now what we can do is incorporate portions of this into our diet. Or at least maybe once, twice, 3 times a week, try and incorporate this sort of thing into our diet to try to keep our risk under control. Next slide, please. Some people think that if they go and see a doctor, gives them cholesterol tablet, then they can eat whatever they like. It's not true. The benefit you get from a cholesterol tablet is significantly reduced if you don't change your diet. So you still need to change your diet, and that is also a very key message. Whether you take a tablet for your blood pressure, whether you take one for your cholesterol, whether you do for your diabetes, whether you have weight loss surgery, none of that excuses you from taking all the steps we've talked about to help to reduce your risk. Next slide, please. This is really for medical professionals, so what we do with people who have high cholesterol and how we decide to give them tablets. But the bottom line is once your doctor has seen you and decides that you need to take a cholesterol tablet, then you need to take it, as I discussed earlier. Next slide, please. Next slide, please. And then what reduces cardiovascular risk most? Is it physical activity or cardiovascular fitness? What this study showed was that if you just increase your physical activity alone, you don't actually have to be fit. Just by increasing your physical activity, you can reduce your risk by 30%. If you have cardiovascular fitness, you can reduce your risk by 60% just by being fit. So again, these are things that all of us are capable of doing without necessarily coming to see a doctor, without spending lots of time in hospitals. Next slide, please. And also, if you look at this, if you look at your risk, so if you have high cholesterol, hypertension, smoking, and you take an aspirin, you have very high risk. If you take a statin for your cholesterol, you control your blood pressure, you stop smoking, you take an aspirin, your risk can be as low as 13.6%. Okay? If you don't do all those things, your risk is as high as 37%. So you reduce your risk by 60%. Next slide, please. So in conclusion, lifestyle modifications, which are within the gamut of all of us, can have a significant effect on lowering your cardiovascular risk. It's important to lower your cardiovascular risk because this is the biggest cause of death in the world today, and it's probably the leading cause of death in Nigeria as we speak. Because you do lifestyle modification does not mean that if your doctor says, okay, you're exercising as much as you like, you've lost weight, but your blood pressure is still high, or your cholesterol is still high, you need to continue doing those things as well as take your tablets under the guidance of your physician. Next slide, please. And that's me. Thank you very much.